And as you know, Eyewitness News is your vaccine authority. And we just mentioned it. Tomorrow, those 45 and up eligible to sign up for their vaccines. And now with more people getting their shots, more questions are being asked. So we are here with some answers. And joining us to do just that, Dr. Andrew Heinrich with the Yale School of Public Health. Dr. Heinrich, thanks for taking some time for us this afternoon.
Thank you. It's a pleasure to be here.
So first question, here it is. With more vaccines coming in, providers are starting to let people choose which shots they want. Any advice on how to pick?
Most important thing you can do is ask your doctor. If you have a risk of anaphylaxis with respect to certain ingredients in certain vaccines, then that might make the choice for you. And so ask your doctor, and if they tell you that there's one you should prefer, then that's your option. Otherwise, one has one dose, two others have two doses, and the choice can really be yours at that point.
I would assume the bottom line, though, is just making sure that you get one of those vaccines, no matter which one it is.
Yeah, getting vaccinated is the most important point, and encouraging those around you who are eligible to also get vaccinated is the most important thing you can do.
Darlene from Rocky Hill also has a question. She says, has anyone that has been fully vaccinated been infected with COVID? Very good question.
I'm so glad she asked that question. So 2 points. First of all, even 90-something% efficacy is not 100% efficacy. And her question about whether someone has been infected is slightly different than the question as to whether someone has gotten sick. So there are certainly those who have been shown to have been carrying, they are infected with COVID after being vaccinated, but the goal of the vaccine is to ensure that they don't get sick once they've been infected. And there was a case, for example, of a member of Congress from Massachusetts for whom that was the case after he was fully vaccinated and he did not show symptoms, which means the vaccine did its job.
We also talked this week about UConn women's basketball coach Gino Auriemma, who became infected just a few days after receiving the second dose. But he is asymptomatic, as you mentioned, and also he was not technically fully vaccinated because he hadn't gotten to that 2 weeks after the vaccine. So I wanted to make sure people understood that point as well.
Absolutely. Yeah, there's about a 7 to 10 day waiting period, according to the FDA and the CDC and the National Institutes of Health, before the immunity after the second dose or after the Johnson & Johnson single dose, that immunity is conferred.
All right. And last question for you. And this actually was something that Mark and I had been talking about last night. If I had COVID but didn't know I had it at the time I got the vaccine, would that be a problem? Because obviously there are people who get COVID and are asymptomatic.
It's a great question. And so first of all, your viewers should know that when they go to get the vaccine, they'll be asked a lot of questions about just this. And so obviously they should answer all of those questions truthfully. To that point, though, obviously you're right that it's not inconceivable that this could happen accidentally. It's not the case that they would be at risk of not getting immunity. They might have a stronger reaction, for example, but it's not the case that it would nullify somehow the effects of the vaccine.
All right. Good to know and great answers. Dr. Andrew Heinrich with the Yale School of Public Health. Thank you so much again for being with us this afternoon. We appreciate it.
My pleasure. Have a good rest of your day.